Good morning to one and all present here. I hope I'm visible to you all and I'm audible. If yes, can you please drop a message in the chat, any one of you? If I'm audible and if I'm visible, please drop a message in the chat. Hello. Hello. Renuka, can you tell me if I'm audible?
Yes.
Okay.
Yes,
Thank you so much,
you're audible.
Renuka. Okay. Okay. We'll begin the presentation. So I would like to first introduce myself. I'm Arthi Krishnan. I am practicing as a clinical psychologist in Buddhi Clinic. So today I'll be speaking about autism awareness. So we'll be discussing the signs, the symptoms, and how to care for an individual with autism. So let's get started. Okay. So, from science to support, navigate autism with insight and care. That's the topic of today's presentation. First, we'll begin with what is autism spectrum disorder. So, when it comes to autism, it's a neurodevelopmental condition. What happens to a person with autism? It affects their communication, their social interaction, and their behavior. So, these are the three major domains that are affected. So, why is it called autism spectrum disorder? Spectrum is because individuals who have autism, they are regarded as having neurodiversity. Okay, they're neurodivergent. So when we say spectrum, it means that autism manifests differently in each and every individual. It's not a one size fits all, it's different in everyone. And how is autism? It's a lifelong condition, but it's not a disease. This means that with treatment, with care, and with rehabilitation, autism can be managed and it can be made better for the individuals who are having this condition. So, what are the early signs? So, when it comes to early signs, there are some markers which parents or caregivers can notice. So, when they notice these early signs, they can be aware. So, when do these early signs emerge? These early signs emerge between the age of 18 to 24 months. So, by the time a child is 2 years old, you can notice at least few of these signs which can indicate the presence of autism spectrum disorder. So, what are these signs? First, we have limited eye contact. So, when we're engaging in social interactions, it is ideal to look into the eyes of the individual that you are talking to. But when it comes to individuals with autism, their eye contact tends to be limited. Next, speech. Speech is also an integral part of your social interactions, your communication, right? In speech, we have speech comprehension and we have speech production. That is understanding speech and producing speech. So, we as social human beings find it very important to talk to people, to communicate, to get our ideas across, right? So, individuals with autism, they tend to have delayed speech, or sometimes they may have speech when they're born, they acquire it and lose it later. So often some mothers and some fathers report that, my child was able to speak when he or she was born, like was able to produce monosyllables, was able to communicate, but later there was a decline in speech. So this is something that we also observe. So like I said, it's a spectrum, and for each individual it is different. So even the speech aspect can manifest differently in different individuals. Next, we have repetitive behaviors. What do we mean by repetitive behaviors? When individuals engage in one particular activity or one particular behavior over and over again. What are some examples of repetitive behavior? What can individuals with autism spectrum disorder do? So, there can be repetitive head nodding, there could be repetitive body rocking, there could be repetitive nail biting, or they may engage in repetitive play behavior where they prefer certain toys and they repeatedly engage with those particular toys. This is something that we can notice in their behavior. And talking about play, ideally, we expect children to mingle and interact with others and play in that manner. But individuals with autism spectrum disorder have the tendency to engage in solitary play. So they prefer their solitude, they're sort of in their own bubble. And when you try interacting with them, that is something that they don't prefer much. So it's a form of them isolating themselves and engaging in solitary play, solitary and repetitive. Next, what about their routine? In the routine, they expect it to go in a similar manner almost every day. And when you make changes to their routine, they may not react to it that well. So they have preference for routine and for things to align the same way every day. So their tolerance to change tends to be low. Now, what other early signs can you notice? Social smile. So, right now I'm smiling, and if someone is interacting with me, it's possible that they would smile too in a social setting. But individuals with autism tend to smile less. Just like their eye contact is limited, the social smile can also be less frequent and it can be limited. And another thing is, let's say their mother or their father or their caregiver is calling out to them and they're calling out their name. Children with autism tend to not respond that frequently to their name. And this again is tied to their other aspects, that is, preferring solitude, right? Preferring to engage in repetitive behaviors. So, while they do this, it's likely that they may not respond to their name. So these are some early signs that we can notice in children with autism spectrum disorder. So does it mean that if these early signs are there, it's a definite marker of autism? We're not concluding on that. To know if it is autism, we need to uh, s- assess them with standardized procedures. We need to take their developmental history. There is a comprehensive procedure, but we are noticing these early signs to be aware so that we can contact professionals and assess accordingly and start early intervention. So these could be, the early signs, but we are not drawing any definitive conclusions based on these signs. Next, so when there is any condition, people may wonder what are the causative factors, like what causes autism spectrum disorder. So over time, there has been ongoing research, not only about autism, but even about other conditions that come under neurodiversity, be it ADHD, other conditions. So when it comes to autism spectrum disorder, what has research shown? First, we'll cover genetic factors. So research has shown that there is a strong genetic component when it comes to autism spectrum disorder. So, autism spectrum disorder tends to run in families. So, it's possible that other children in the family could have this condition, or in the genetic lineage we may see that autism might have been present in other members, right, in like close relatives, right? So genetically there is a major role. There are multiple genes that are likely involved, and also some genetic mutations that happen can be inherited, and some occur spontaneously. That is, some mutations may be present in the parents and that can get inherited, or maybe they were not inherited and after the child was born some mutations can happen, right? So it can happen in that prenatal scenario, or it can happen after the child has been born. So, what are other genetic disorders that are closely linked with autism spectrum disorder? We have Fragile X syndrome, Rett syndrome, tuberous sclerosis. So, these tend to become a high risk for autism. So, if a child has Fragile X syndrome, Rett syndrome, and tuberous sclerosis, then we need to carefully and closely assess them for the related condition, which is autism spectrum disorder. Next, we'll come to the neurobiological factors. So, when it comes to autism, we also need to understand the brain's anatomy and the brain's function. So, in individuals with autism spectrum disorder, there could be altered development of structures like the amygdala, the hippocampus, the cerebellum, the prefrontal cortex, right? So if I were to share, like the amygdala is closely involved in processing emotions, like memories related to emotions. Hippocampus plays functions related to memory. Then we have prefrontal cortex, which is important in decision making, right? It also impacts how our personality is, right? So if there is altered development of these brain structures, then it can definitely impact conditions like autism spectrum disorder. Then the brain's regions are connected, right? The lobes are connected, the brain's anatomy has connectivity. So in individuals with autism spectrum disorder, there could be atypical connectivity, right? That is connectivity that is quite different from how it is regularly. Then, what other neurobiological factors are involved? There could be imbalance in neurotransmitters like serotonin, dopamine, and GABA. So, serotonin, dopamine, GABA, these are neurotransmitters that regulate day to day functioning. So, they have their own functions. But if there's going to be imbalance, either excess or low, it's linked with mental health conditions. For example, in depression, there tends to be lesser dopamine, lesser serotonin, right? GABA is also linked with other conditions like alcohol dependence. It's the inhibitory neurotransmitter. So, in autism, also these neurotransmitters tend to play a role. Next, what other factors are involved? We have prenatal and perinatal factors. So, this is concerning pregnancy. So, if there are maternal infections like rubella, then it can impact the occurrence of autism spectrum disorder. And let's say the mother has exposure to toxins, drugs, or alcohol during pregnancy, then this can also impact the presence of autism spectrum disorder. Then, if there is gestational diabetes or high blood pressure, then this also is a factor which impacts. And let's say, like, these are some prenatal factors. What about like perinatal factors? If the child is born with a very low birth weight, or if there's a premature birth, then there could be a higher risk for autism spectrum disorder. And apart from this, if there is developmental delay, that is in speech, if there is a delay, and delay in other functions, then it can be linked with autism spectrum disorder. Then apart from this, what else? What if this, birth trauma, that is when the, child is born, like there is, lack of oxygen, this condition called hypoxia. This can also, impact these factors, right? This can impact the neurobiological factors, right? That how the brain is developing, how the structure is, how the functions are. So these neurobiological factors tend to be linked with even these prenatal and perinatal factors. But do these factors mean that it will definitely lead to autism spectrum disorder? No. These are just causative links. These are not definitive factors, but these give us some idea that, okay, this can cause autism. Then, what about environmental factors? So, let's say the mother is exposed to high levels of air pollution or like heavy metals, then it can definitely impact how the fetus is developing during pregnancy. Similarly, exposure to pesticides and chemicals, they can be harmful for the mother and also the child. Now, what about another factor? Advanced parental age. So let's say the age of the mother, like during pregnancy, is when she's quite older, then this can affect. But this does not mean that if the mother is older, it will surely cause autism. This is just considered to be a risk factor. And what about prenatal stress or inflammation? Yes, ideally, it is expected that when the mother is pregnant, she should have a smooth pregnancy, she should have nutritious meals, she should not be exposed to high levels of stress, that is interpersonal conflicts and so on. She shouldn't be exposed to any form of trauma or injury or anything like that. So if these factors are there, then it can impact how the child develops, right? It can impact. But again, we are not definitely concluding that if this is there, then this is the causative factor. We are just seeing links. Okay. How do we diagnose autism spectrum disorder, right? So some time ago we saw these early signs. These early signs are markers or indicators, but what gives a definite diagnosis? So early screening. So it's recommended that starting 18 months, like we do these early screenings so that the pediatrician can find out if anything is problematic, right? Be it in their communication, be it in their behavior, be it in their functioning or in their development. Then, when we gather the developmental history, we understand, right, if there's any delay or if there's any abnormal functioning, right? We also observe the child. That is the child not engaging in social smile, not engaging in eye contact, right? If the child is not speaking, right? If there's any speech issue, and apart from this, if the child is engaging in solitary repetitive play, so these are some things that we can observe. And for behavioral observations, of course, the caregiver's observations are very important, but the observations of a very trained professional, be it a psychiatrist, a clinical psychologist, a psychiatric social worker, a nurse, these observations matter too. Apart from all of this, we also use standardized assessments. So I'll give you the example of Buddhi Clinic. So in Buddhi Clinic, when a child and caregiver come in, we take a detailed developmental history. The medical officer takes the history. Then we do other assessments in the mind lab, where we use the Vineland social maturity scale to understand how their social quotient is, okay, what their social age is. Then we have the AAMR behavioral checklist, where we try to understand how their behaviors are: repetitive behavior, hyperactivity, disruptive behavior, destructive behavior. Are there any violent behaviors, right, towards others, self injurious behaviors? So, these are various domains that we assess and check if these behaviors exist. Then, apart from this, we have autism specific assessments as well. So, we have the ESA, right? So, Indian scale for screening autism. Then we have cars for high functional children. We do this, and while we diagnose autism, we also check other comorbid conditions. So it's not autism alone, we also check if there are other features like ADHD, because comorbidity is likely to be there, not always, but in many cases we've seen that children with autism also show other comorbid condition and vice versa. Okay. So, what are the major areas affected? Like I said, social communication, that is not only verbal communication, but even non-verbal communication can get affected. That is in their gestures, in their facial expressions, right? So, how is their speech? So, in speech, we may notice this condition called echolalia, where they are repeating what the other person is saying. Let's say you say hi, they say hi. Like they're repeating what you are saying, right? And they may even repeat gestures. Like if you engage in some behavior, they may try mimicking that, right? So in their social communication, we can observe these aspects, right? And even in social communication, we can observe that we are calling their name, but they're not responding, right? And speech, of course, tends to be affected. But there could be some individuals with autism spectrum disorder where speech is intact, but they show other features of autism. That's why I said it's a spectrum and not everyone is going to be the same. And there could be some individuals where speech is intact. Then in behavioral patterns, like I said earlier, there is repetitive behavior, right? Engaging in solitary play. And in behavioral patterns, they have this preference for routine and they do not expect it to change, right? In sensory processing, there could be heightened auditory or visual, like, processing, right? Or they could have this savant memory where they remember things in detail, right? More in detail when compared to other individuals, right? And they could also have a tendency to touch an object, right? Through touch they could pick up and smell objects, right? They could do this while engaging with the environment, right, using their senses. And we may wonder, like, they're not able to speak. Is their, hearing normal? Yes, hearing can be normal, but despite that, speech production can be difficult in individuals. And like I said, language development, there can be delays in language development. Okay. Now, what are the benefits of early intervention? So, when a condition goes unnoticed, or if we let it slide, then at a later stage, like treatment becomes more difficult. But if we do early intervention, then what can we do? We can improve their language skills, we can improve their social interaction, we can enhance their cognitive development, and we can reduce challenging behaviors. So, in language, there is a major contribution of the speech therapist. So, the speech therapist works closely with the individual with autism and they help enhance their speech. Then, social interaction. So, they tend to engage in isolated and repetitive play, right? So, from there, we take them to interacting more with others. So, this is something that we can work on in therapy. And by giving them structured play activities which involve like cognitive tasks, from time to time, we can enhance their cognitive development, like their memory, their attention, their problem solving, their decision making. We can gradually enhance these functions, which will again improve their social interaction as well, because if their attention is going to be better, if their concentration is going to be better, if their language skills are going to be better, then they are going to interact better in social settings, right? Then we have challenging behaviors, right? We have these repetitive behaviors. There could be violent behaviors, there could be rebellious behavior, there could be destructive or disruptive behavior. So in therapy, what we do is we reduce these challenging behaviors, right? With structured short term and long term goals of therapy, we target these challenging behaviors and we reduce them. And in therapy, it's not only the therapist and the client, but the parents or the caregivers tend to be co-therapists, right? Because it's the parents and caregivers that take care of the child in the home environment, right? Outside the therapeutic space. So parents and caregivers are equipped with strategies to target these behaviors and eventually reduce them. And we not only reduce challenging behaviors, we also improve adaptive behaviors. So ideally, we may think like when we do rehabilitation for autism spectrum disorder, like what is it? Is it just speech therapy? Is it just going to be like psychological therapy? But apart from speech therapy and psychological therapy, we have other therapeutic approaches which have been successful. Like we've observed through research that they have been successful. So, what are these? We have neuromodulation and neurofeedback. So, in neuromodulation, there is stimulation of the brain and it is non invasive. So, it's not like a surgical procedure. We are not, but we are stimulating different regions in the brain so that we can enhance the functioning, right? Like by doing that we can notice that their functioning improves. What is neurofeedback? Through neurofeedback we see that attention, concentration improves, and also their functioning and also improves. So this neuromodulation and neurofeedback goes hand in hand. Then we have psychological therapies. So in psychological therapies, we have behavior therapy, which helps bring in like behavior modification. So we have various strategies like reinforcement, token economy, timeout. There are like different behavioral strategies that we use to help the child to reduce the problem behaviors and to improve adaptive functioning. And as part of psychological therapies, parental counseling is also very important. So, caregivers come in with a lot of distress, right? That I'm finding it hard to take care of my child who has autism spectrum disorder or other conditions. So, we address that caregiver distress, provide them with a safe space to open up about their concerns, and we provide them with support. And we provide them with structured tools and techniques which they can employ to assist better outcomes in their children. What else do we have? We have Ayurveda, we have yoga, we have naturopathy. So it's not only like things that come from like the Western side, we also have some ancient wisdom and knowledge systems that can truly contribute and enhance functioning in individuals. So in that we have Ayurveda, yoga, and naturopathy. And now there is like ongoing research which shows the effectiveness of these therapeutic modalities. So in Ayurveda, we have Shiro Abhyanga, we have these massages, and through Ayurveda, we can regulate the diet, the dietary, like, intake, right? And we have yoga, which is not only about, flexibility or like a form of exercise, but yoga promotes holistic well being, right? It's for the mind, body, and self or soul, like some people would like to call it. So we have yoga, we have naturopathy. So these complementary and alternative medicine options also exist. Then we have physiotherapy and NDT. So in physiotherapy, we have these physical therapies where we can enhance functioning, right? Some children come in with hyperactivity or their physical functioning is not good. So in physiotherapy, we have like structured therapeutic programs where we can improve their function. Then we have occupational and speech therapy. So in occupational and speech therapy, we target that language domain and the social interaction and communication domain. So by doing this, we do intervention and we improve the functioning. And often when children with autism spectrum disorder have comorbid conditions like ADHD, they have a lot of like physical energy within them which needs to be channelized and utilized in a proper way. So the activities that are done in physiotherapy really help channelize that and help uh, reduce the behavioral challenges, right? So these are the various therapeutic approaches that we can utilize. So we may wonder, okay, for psychological therapy, I need to go to one place. Okay, for neuromodulation, I need to go to another place. I need to go for like speech and occupation therapy to one more. Then I have to find another, like, Ayurveda physician, for physiotherapy, another. So sometimes, caregivers think that, where all will I go? Right. But what if you find all of these therapeutic modalities under one roof? That becomes easier, right? So when it comes to Buddhi Clinic, we have this integrative model where we approach any condition with an integrative approach, right? So why treat with one modality when like multiple modalities and multiple therapies can come together and enhance outcomes, right? And in Buddhi Clinic, we periodically review the effectiveness of these modalities in treating various conditions. So far we've seen successful outcomes in treating autism spectrum disorder. Like I said, Buddhi Clinic provides integrative autism care. So here we focus on early intervention, integrated care, and there is consistent follow up. So it's not only about providing intervention, but it's also in long term following up and checking if the individual is functioning well. Right. So we have comprehensive therapeutic plans and monitoring, which goes on periodically. So while a client comes in the start of therapy, we assess them. In the middle of therapy, we assess them. And in the end of therapy, we assess them. So doing it this way makes it systematic and we're able to, track the progress. We're able to track if the problem areas, if there's any improvement in it or not, right? And Buddhi Clinic currently has its setup in 5 places where Tenapet is the head office. Then we have it in Coimbatore. We have it in OMR, which is inside the Apollo facility. We have it in Sri Perumbudur and also in Indore, where OMR and Indore are collaborations between Buddhi Clinic and Apollo. So under one roof, we have all of these like therapeutic modalities, so it improves the outcomes and we see like results in a shorter time in comparison to just using like one therapeutic modality. And during the mid of therapy reviews and end of therapy reviews, it happens with the doctors. We have our chief medical officers evaluating, and they talk to the caregiver and they find out how therapy is going, and periodically like feedback is taken to incorporate the needs and expectations of the caregivers and the client. So this is something that we do. And like I said, early intervention is what is primarily recommended. When we do early intervention, like we have better outcomes. But sometimes like children come in at a later stage. For example, they come in when they are 10 or 11 years old or 12 years old. Even then, some intervention is better than no intervention, right? So even in children and adolescents who come in late, we can work well with them and enhance their development and their functioning. And let's say initially someone comes in and we've provided them therapy, right? After that intensive program, we also have this step down where like they come in once in a while and we maintain the goals that we've achieved in therapy, right? It's not only about achieving some goals, it's also about maintaining those goals and also preventing relapse. So this is the type of approach that we take in Buddhi Clinic to provide complete brain and mind care. So yeah, this was my presentation on autism spectrum disorder awareness, the signs, the symptoms, the diagnosis, and the care. So now we can open the dice for like questions and discussion, and of course, feedback from you all. So, yeah. So, if we could open the dice for questions, that would be great. And of course, I would really appreciate your feedback on the presentation. So, please let me know. Okay, chat shows disabled. Let me just enable that. Give me a second. Yeah, am I still audible to you all? Are you able to see me?
Yes.
Okay, thank you, Renuka. Yes. So, you're still able to see me and hear me. So, like, from the audience, do you have any questions about the topic that we have discussed today? Any questions, any insights, or anything that you realized during the course of this presentation? Okay, I just received some feedback that not able to like chat and unmute. Just give me 1 second. 1 second. Yeah. So I've been getting like questions. So from Jeggy. So okay. Hello, ma'am. My son is 9 years old. It's been 5 years since we started. Still, there are lots of behaviors. He goes to normal school, uh, and his sitting tolerance is also low. Could you help me out how this therapy will help us? Okay. So, hello, I'll answer your question. So, the child is 9 years old, right? And he is going to normal school and he's showing low sitting tolerance, right? So, if he takes therapy, then this sitting tolerance is something that we will definitely address. So we have these structured activities which we engage the children in, where we will gradually, improve the sitting tolerance through that. When we do neurofeedback and neuromodulation, that also enhances the sitting tolerance, ma'am. Even through physiotherapy, we can target the sitting tolerance. And when we use all of these therapeutic modalities together, definitely the sitting tolerance will improve. And ma'am, during therapy, because we also provide parental counseling, we will be giving you a lot of strategies of what you can do to help your child. So we will be giving you proper reinforcement strategies, behavioral management techniques, right? That's something that we will provide you. So therapy will definitely help your child. So I highly recommend you to enroll your child in therapy. So, yeah. Yeah. Yes, we have a question from Mr. R. Srinivasan. So, yes, you can unmute yourself, sir, and you can ask. You've raised your hand. Yes, sir.
What happens if you notice at a very late stage? Can it be cured?
Hmm. Yeah, that's a good question. Like I said, we recommend early intervention, but even if we notice at a later stage, we can still improve outcomes in their life. And you asked, can it be cured? Like I said in the starting of the presentation, autism spectrum disorder is not a curable condition, but it is a manageable condition, right? So if there are behavioral issues, we can reduce the behavioral issues. If there is a speech deficit, we can improve the speech. And if there is social interaction deficit, we can improve that, but we cannot completely cure it, but we can definitely manage it and improve their functioning. So even if it is noticed late, and even if we start intervention late, we can still do something, but early intervention is something that is recommended. Yeah, does that answer your question, sir?
Yes, very nice.
Thank you. So we have a feedback from Renuka saying the topic was insightful. Thank you so much. Do we have any other feedback, comments, or questions? Okay, we have one more. Okay, we have another like feedback from Bhavani Kumar. So from Bhavani and Shankar, it was a very good session. Thank you so much. Thank you, Keetana Devi, for your wonderful comment. Thank you. Yeah, Bhavani Kumar says the audio is not working and they would like to type. Just 1 second, I'll allow you to speak. 1 second. Yeah, Bhavani ma'am, you can unmute and speak. Please go ahead.
Hello, Miss Arthi. This is
Yes,
Shankar, Rukmi's dad. Uh,
yes,
Bhavan is on another call, so I just want to ask some question regarding veterinary.
yes, yes.
He's okay, but and sudden moments he has some bursts like suddenly he cries. Sometimes suddenly he
Hmm.
smiles out of nothing. So we just
Hmm.
want to know, like, is this something related to this, or how it can be like
Hmm.
mm, regularized or something?
Yeah, that's a wonderful question. So, sir just mentioned that their child has these outbursts and sometimes, he cries, right? So, this is something that we can notice in many children, whether they have autism or not. Like, they can have temper tantrums, they can have outbursts. But in autism spectrum disorder, because there is a speech deficit, right? There is language communication issue, right? So children, because they're not able to verbally communicate or put forward how they're feeling, they find other ways to express it, right? So crying is one way, right? And if they're going to get overwhelmed, then their emotional expression can be in this form, right? So if we work on the speech, right, then their verbal communication improves, and even we can target the non-verbal communication. So together, when we do that, then we notice that the outbursts, the tantrums reduce because their communication improves, right? So that is something that we can do, sir. And we can also work on the emotional regulation in the child apart from the speech. So we can focus on emotion regulation strategies. So that's something that we can definitely focus on in therapy. And when a child is crying, it means that they want the parent's attention. They want the parent to like attend to them, right? So there's something on their mind which they want or they desire, which they're not able to verbally say. So they express it, in the form of crying or in the form of outbursts. So in that moment, attending to them and trying to notice, like, what is going on. And we also need to notice, like, before this outburst has happened, what happened before that, right? And when that outburst is happening, how are we responding to them? We need to be aware of our own responses towards them. So when we analyze this, we get more idea on why it is happening, right? So this is something that can be done.
Perfect. Okay, that answers my question. So usually, what happens is we try to keep him happy as much as possible. Like
Hmm.
we give him the toys. We make sure that he
Hmm.
has done his potty. All everything. But
Hmm.
suddenly, he just out of nowhere, he just breaks down. So
Hmm.
that is
Hmm.
concern. But what you said is makes purely clear. Like. Maybe he's trying to communicate with us something, or since he's
Hmm.
not able to communicate, maybe these kind of outbursts are happening.
Hmm.
So
Hmm.
you suggest like more on the speech therapy and things,
Hmm.
right?
Yeah,
Okay.
the moment we work on the speech, then the communication becomes more verbal and he can express, right? That if I am not satisfied, it's because of this. If I am sad, then it's because of this. I am feeling frustrated. He'll be able to communicate that verbally. So that's something we can work on. Yes. Thank you for your question, sir. Yes.
Thank you. Thank you. That was a great presentation. Thank you.
Thank you so much. Thank you so much, Kalpana ma'am, for your feedback. We have an anonymous attendee who's asked a question. How to handle head banging and self-harming behaviors. Yes, that's a great question. So when it comes to behavioral issues, right, self-injurious behaviors are also one category where they can hit themselves, harm themselves, and they could even bite themselves, right? They could do this. It's not only about hitting others, they could hit themselves also. So what we do is, this is a behavior that we need to reduce gradually over time, right? So we have these reinforcement strategies in behavior therapy which we employ, right? Using positive reinforcement, negative reinforcement, these are some techniques that we use to target these behaviors, right? And apart from that, like I said for the previous question, we bring emotional awareness and emotional regulation within the child. When we do that, when they regulate their emotions, then they're less likely to bang their head and harm themselves, right? And some things could be habitual, like they have this minor irritation or inconvenience and immediately they go and like hit themselves, right? So they could have that. So we can teach them, like soothing techniques and calming techniques and relaxation techniques. So by doing that, the self harm and head banging and injurious behaviors like reduce. So definitely this is also like targeted in therapy, like these behavioral issues. Yeah. And yeah, we are told that to do more sessions like this, definitely we'll come up with more informative sessions for the audience, like about autism, about ADHD, and other mental health conditions. So we will definitely come up with such sessions which will be useful for you all. And like, we really appreciate such feedback. It keeps us motivated to do more. Thank you. Do we have any other questions or feedback? Okay, if we don't have any other questions, then we can wind up. I would like to thank all the participants who are present here right now. I really appreciate you all, taking out the time. Before that, we were asked one more question. What kind of therapy do you have for ASD kid? Okay, so for a child with autism spectrum disorder, ma'am, we have like multi-therapy approach in Buddhi Clinic. So we have neuromodulation, we have neurofeedback, which involves like, non-invasive like brain stimulation, improving attention, concentration. We have psychological therapies, ma'am. So in psychological therapies, we have behavior modification, behavior therapy, parental counseling, right? We have all of that. Then we have complementary and alternative medicine, like we have Ayurveda, yoga, naturopathy, and all the techniques that come under that. We have physiotherapy, and after physiotherapy, we have like speech and occupational therapy also. So in Buddhi Clinic, we have around 14 modalities of therapy which fit under these categories, these five major categories. So we have integrative care. So if you are considering therapy for your child, we would definitely ask you to reach out to like Buddhi Clinic. We have like five branches, so you can choose any of the branches and reach out to us. So yeah. And I will drop my email in this chat. So if you would like to like reach out to me and discuss more in detail, we definitely can. So I'll just put my email here. So my email is arthi@buddhiclinic.com. So if anyone has any doubts that you would like to discuss or know about the treatment or know about what needs to be done, you can definitely reach out to me and you can write to me. So yeah, any other questions? Okay, if we don't have any other questions, I would like to take this moment to thank all the participants here. Like, it means a lot to me that you all took out the time to come and attend this session, and I am motivated to host more talks like this. So, thank you so much for attending, and we shall meet again in the next talk that will happen soon. Yeah, thank you so much. Yeah, there's one more question. I'll answer this for you, ma'am. We have like 2 more minutes. So for ADHD kid, what kind of assessment will be there initially? So when we do screening, ma'am, we take a thorough history. We get to know about the developmental history. That will be done by the chief medical officer. Then after that, what we will do is we will do a clinical psychologist or psychologist assessment, where we do a social functioning assessment, like we use VSMS. Then we will do a behavioral checklist where we get to know what are the problem behaviors in the various domains. Then we screen for ADHD. So depending upon their social functioning, we decide if we will use Vanderbilt or we'll use corners. There are different like diagnostic rating scales which help us determine whether ADHD is there or not, or what type of ADHD is it. Is it inattention or hyperactivity or both? So we'll assess using these rating scales, and we may go for other comprehensive assessments as well, like intelligence assessments, IQ tests, and so on. So the assessment will be comprehensive. Basically, we do screening, we take developmental and medical history, complete history. Then we do these assessments, and then we give you a report and recommendations. So that's the process. Yeah, so this anonymous attendee, thank you so much for your questions. You've asked a lot of interesting and like very much needed questions. So thank you for that. On that note, we'll conclude this session. And if you have any other further doubts, please feel free to like write to me on my email address, which is arthi@buddhiclinic.com. So thank you for joining and take care. Thank you.